Hi, and welcome to this educational video, Introduction to PAR Inventory Management. In this video, you will learn about how PAR inventory management typically works in the healthcare supply chain setting. This video is presented by Trident Edge Consulting, where it is our mission to provide thoughtful instruction, tips, and guidance on healthcare supply chain topics to passionate supply chain professionals, just like you. When it comes to PAR inventory management, there are two key terms that you should be aware of. The first is PAR. As discussed in a separate video devoted to common terms in healthcare supply chain, the term PAR means periodic automated replenishment and can be used to designate any storage location that's not a perpetually tracked location. Plus, the term PAR can be used to designate the maximum stocking quantity for a given item at a certain location. For example, you might hear someone say, "There is a PAR location in the emergency room." Alternatively, you may hear someone say, "The PAR for item number 433 is 20 vials." Another useful term is mobile PAR counting. This term is used to indicate that the PAR replenishment process is performed using a handheld device. PAR locations are the non-perpetual supply inventory locations in a clinical or other hospital department that are managed by supply chain. The inventory in these locations is owned by the department. In other words, as soon as the supplies are issued to a PAR location, or as soon as a PO receipt associated with a PAR location is completed by the receiving team, the department is charged for those supplies. As a result, there's no need to record issues or returns in a PAR location. PAR locations are considered ideal for clinical areas as they enable clinicians to walk up and take what they need without the burden of recording the transaction. Even so, some PAR locations do contain supplies that are chargeable to hospital patients, and these supplies must be labeled in a way that reminds clinicians to properly account for these patient chargeable items so that the hospital is not losing revenue on chargeable products. A common hospital PAR replenishment process is shown here. If you start at number 1 on this diagram, you will see a picture of an actual hospital PAR location. As mentioned previously, the PAR replenishment process is initiated by a supply chain staff member walking through the location at a designated time. During this walkthrough, they will look for items that are running low and will create an electronic requisition for the items that need to be ordered. In most hospitals, this process is managed using a handheld device, like the one shown here next to the number 1. If mobile PAR counting is in place, each PAR bin label will have a barcode for the item number for the supply that's stored in that actual bin. However, there are many organizations that do not use handheld devices. At these locations, the supply chain staff member will write down all of the item numbers for the items that are running low, as well as the on-hand quantities or the quantity they would like to order. After they've collected this information, they will key this information into a desktop computer to generate the electronic order. Once the electronic requisition has been entered, either using a handheld device or a desktop computer, the inventory software will determine the replenishment source for each item and will send storeroom items to the inventory picking module, as shown near the number 2. And supplier sourced items will be sent to the purchasing module, as shown near the number 3. From there, the issues from pick list process will be used to pick the storeroom items. See numbers 4, 5, and 6 on the slide. And the PO to receipt processes will be used to replenish the supplier sourced items. See numbers 7, 8, and 9 on this slide. Some healthcare systems and hospitals have invested in point of use inventory management solutions, also known as advanced replenishment solutions, for the management of inventory in departmental storage areas. Please note that when this type of advanced solution is in place, there is still a tendency for hospital staff to call these locations PAR locations, so be aware of this to avoid confusion. Commonly used point of use inventory management systems in U.S. hospitals include Pyxis, Par Excellence, Omnicell, QSight, eSIMS, and TrackCore. In most of these systems, the clinician or departmental staff must record all takes and putbacks for the software to track accurate inventory quantities. For example, some systems use barcoding scanning, others use touch probes or push buttons. There are also some systems that have load cells or scales attached to the product bins, and the system can physically weigh each bin regularly to calculate the actual on hand quantity of each item. The potential benefits of using a point of use inventory management solution are: 1. If you can get the department staff to comply with the necessary take and put back transaction steps, the system will be able to keep track of the actual on hand quantities throughout the day. If this occurs, the entire replenishment process is improved due to eliminating the need to physically count each low item. 2. The quality of the replenishment process is also improved, as every low item can be automatically reordered, rather than only reordering the items that the PAR count staff visually identified as having low stock on hand. 3. If you integrate this system with the patient billing and patient admissions discharge systems, the take and put back transactions can be used to charge patients for supplies used in conjunction with their care. In practice, however, not all staff will comply with the take and put back transaction steps. Further, even at locations that utilize the weighted bin approach, the approach that has scales attached to each product bin, it is not uncommon for someone to place products in the wrong bin and for scales to become inoperative. As a result, if you have any of these advanced replenishment solutions in place at your organization, it is vitally important to follow your local supply chain replenishment processes to ensure the proper audits and inspections occur before the orders are generated. The final inventory concept that we will cover in this course is the two-bin Kanban method. What is a Kanban? Kanban is a term developed by manufacturers to describe a lean manufacturing process that uses visual indicators to drive supply replenishment. In hospitals, the two-bin Kanban method of inventory management is a process that can work well for items that fit neatly into bins, such as syringes, bandages, and vials. This process has proven to be effective at reducing stockouts, enforcing first in, first out policies, and reducing waste in a way that is easier to learn than many other types of inventory methods. This approach is often used alongside the traditional PAR inventory replenishment method, as they work very well together. Here is how it works. There are two bins for each item in the PAR location. Each bin is labeled with the item number and item number barcode and the maximum bin quantity. For each item, half of the total location stocking quantity is placed in each of the two bins. The second bin is typically placed directly behind the first bin on the same shelf, as shown in the diagram shown in the top right corner of this scene. It's also common for a top and bottom configuration, as shown in the bottom right corner of this screen. Department staff and clinicians are trained to pull supplies from the first bin until it's empty. Once the first bin is empty, they will place the empty bin in a designated reorder location, often the top shelf. Then they can pull the second bin forward and take supplies from the second bin. When it comes time for supply chain staff to replenish a PAR location that uses a 2-bin Kanban, they will collect the empty bins, and for each empty bin, they will order the quantity that is listed on the label. In many situations, this process is simplified such that the supply chain staff member simply scans the barcode on the label, followed by keying in a count quantity of 0. The system will then automatically calculate the reorder quantity. When supplies are received, they will be put in the empty bin, and the empty bin will be placed behind the bin that is still on the original shelf. As you can imagine, this process can prove quite efficient when properly implemented and adopted. If your organization uses Kanban inventory methods, make sure you understand the processes used so that your organization can be as successful as possible. Thank you for watching all the way to the end. We certainly hope that you have picked up some practical knowledge today and that you have a stronger understanding of how inventory management works in PAR locations and locations that utilize advanced replenishment solutions. If you enjoyed today's video, please like and subscribe so that we know that you specifically would like to see more of this type of content.